Here I am with Ian Mcafferty, who's current president of the BSIR. And obviously, the interventional radiologist plays a crucial role in the care of renal patients. And I'm wondering, how have you seen during your presidency at BSIR how this has really played out, that what you do for renal patients?
Well, thanks, Nick. So originally, we were almost a service specialty. We're there just to back up, the surgeons and the physicians to help them, with their problems. And I think over my 2 years as presidency, we've seen an evolution of the interventional radiologist to actually wanting to take primary care from the patients and work as a full team member. Now, I think certain areas that we've started to develop in over the last 2 years has been renal ablation, certainly with microwave and cryoablation, and actually managing those patients ourselves. And obviously during the COVID period, day case interventions have actually been fantastic for patients. We've been able to get patients in and out in a cold environment. I think other areas I've seen is part of the embolization, whether that be tumour embolization or actually prostate artery embolization, which is it's a new technique to treat benign prostatic hyperplasia in men. And that's actually something driven by the patients. Patients are wanting that rather than having the traditional surgery. I mean, there's a place for both, and I've seen that development coming on. And I think also, finally, we've always been involved in dialysis, access, dialysis, maturation, dialysis, interventions, but actually now we moved into actually creation. And I think it's been brilliant to see, even at this meeting, that the AV fistula creation, endo AVF has actually started to take a good role, and especially in the States, they're doing a vast amount.
Sure, so that role is really important. So it's oncological, it's benign disease, it's dialysis. Where do you see that going, and particularly educating the next generation of interventional radiologists to do this?
So I think there's a number of facets. I think interventional radiology has to grow and actually start to take control of their patient population as well. And that involves developing the team. In other words, so we can actually have clinical nurse specialists. We can have fellows that are actually going to help with the service, because the service is getting larger and larger. And it's almost an exponential curve. So the more we do, the more we will require to do. So I think we need to have those team of, expert clinical nurses who will provide a lot of the vascular access under our supporting umbrella. So we can move forward and do more of the sort of, clever stuff if you want, but actually to maintain that patients get the best access to the service in a timely fashion.
So it sounds like there is a role for almost a specialty renal interventionalist in this.
Well, I think within interventional radiology, the sort of almost the scope of interventional radiology is growing more and more. I mean, traditionally, we were always perceived as a vascular specialty, subspecialty. And I think you're right. I think there are areas now where people will probably get involved in subspecializing within, if you like, genitourinary intervention in the broadest sense, which would, go from varicocele embolization to ablation to vascular, non-vascular, on the whole gambit, not just kidney.
I look forward to seeing that evolution, because I think, the amount of technology coming into this field is real early adopters that interventional radiologists really push forward the field. And that's for the benefit of renal patients. So I think that's great work.
Thank you, Nick.